Vietnam is experiencing a rapid rise in the incidence of non-communicable disease like diabetes or hypertension due to changing socio-economic conditions, industrialization, and urbanization. Prevalence of diabetes was 1.2% in 1994 and 3.8% in 2001. However, recent data in 2009 from Ho Chi Minh City show a prevalent rate of close to 11%. Experts believe that there are close to 5 million people with diabetes, though over 60% remain undiagnosed. Even diagnosed patients are treated suboptimally, and the majority of the patients fail to achieve treatment targets. Data also shows that close to 6 out of 10 diagnosed patients present some complications of diabetes. In response to the growing problem of diabetes in Vietnam, the Vietnam Diabetes Care Program (VDCP) was launched in November 2012 on the occasion of the Danish Prime Minister Helen Thorning-Schmidt's visit to Vietnam. The Vietnam Diabetes Care Program is a collaboration between the Ministry of Health of Vietnam and Novo Nordisk, a Danish healthcare company and world leader in diabetes care. Hello everyone, and you're watching Sharing Vietnam on VTC 10 Net. Vietnam is among the countries with the highest growth rate of diabetes patients in the world. That's why since 2012, Vietnam has established a public-private partnership with a Danish company, Novo Nordisk, one of the world-leading companies on this issue. And on today's program, we are going to have the talk with the General Manager of Southeast Asia Emerging Markets of Novo Nordisk to know more about this public-private partnership. Please join me in welcoming Mr. J. Thiagarajan. Thank you so much for joining us. As I have just mentioned, since 2012, Novo Nordisk has established a public-private partnership with Vietnam on tackling the issue of diabetes. So maybe share with us on the cooperation.
What Novo Nordisk did was to collaborate with the Ministry of Health on a public-private partnership called the address how we can first create awareness about the general public, that they need to know about diabetes so we can diagnose them. The second is how can we screen these patients and diagnose them early so we can prevent these patients from suffering from complications such as heart disease, foot ulcers, cardiovascular complications, neurological complications like kidney failures, eye failures. So there are a lot of complications if you do not take care of diabetes. Then the third objective is we do not have enough doctors to treat so many patients, 5 million diabetes patients, and therefore we have collaborated with the Steno Diabetes Center, which is one of the oldest diabetes hospitals in the world. And we bring the experts from Steno, from Denmark, and they will train together with the Ministry of Health 2,000 doctors over the period of next 3 years. And these 2,000 doctors will then be able to treat many patients in Vietnam. Lastly, the diabetes is affecting children as well, and more young people are getting diabetes nowadays. In the previous era of the last 10 years, it was elderly people, older people who got diabetes, but now you see young people getting diabetes. And therefore, to support children who are suffering from diabetes, we have collaborated with the World Diabetes Foundation, which is a non-profit organization, and they will donate free insulin for 20 children in Vietnam for a period of 3 years. And then we also want to diagnose women who are pregnant, so we can detect them early, even before the child is born with diabetes, and then we can avoid all the bad effects of diabetes.
It has been 2 years since the public-private partnership has been established. So maybe share with us on the initial achievements.
So in the first 2 years of the program, we have been able to reach out to 2 million 2 million general public to create awareness on diabetes with the help of media like yours, with the help of newspapers, with the help of Then we set up a screening camp, free screening camp, and in those camps we have been able to diagnose 25,000 people with diabetes in the last 2 years. And we have been able to train close to 100 doctors in the field of diabetes so far, who can then take care of patients, especially in the provinces of Vietnam, outside of Ho Chi Minh City and Hanoi. And we also, as I mentioned, donated free insulin to these children, and out of the 20 children, 17 children have been already treated for a period of 1 year now, and they are doing extremely well.
Starting from the 6th of November 2012, the Vietnam Diabetes Care Program was initiated through a series of activities in Hanoi and Ho Chi Minh City. The inauguration of a training center at the National Endocrinology Hospital, setting up Changing Diabetes Village in Hanoi, initiation of Changing Diabetes in Children project at the National Pediatric Hospital, and Center of Excellence in Diabetes at Chợ Giấy Hospital. In addition to a training program for physicians, a network of diabetes centers is set up to improve the diabetes care infrastructure in Vietnam. Changing Diabetes events were also launched to raise awareness about diabetes and healthy living in provinces and screening individuals with risk for diabetes. Are there any difficulties that Novo Nordisk have to face on the way to tackle the issue of diabetes in Vietnam?
I think the challenges are, we have 5 million diabetes patients. How do we reach those 5 million diabetes patients? Because 60% of them don't know that they have diabetes. How do we ensure that we provide the right training to the doctors at the right time, so we can diagnose and treat the patients before they come to the hospitals with a loss of their eyes, or loss of the leg, or loss of the kidney, and that is what is the big challenge for us. It is not so much about cooperation with the Ministry of Health, which has worked extremely well, not so much with the hospitals, because they are very, very keen to address the issue of how to diagnose patients. It scale of the problem that we have, that is the challenge.
What are the action plan for the last 1 year in the 3-year action plan of the cooperation between Novo Nordisk and the Vietnamese partners?
Diabetes is a long-term management and requires the support of all key decision makers and people involved in managing diabetes. So, which means that we need the support from the policy makers, we need support from the treating doctors in the different hospitals, the nurses, the paramedical staff, and also the patients and their families, and the general public and media. Yes, the Vietnam Diabetes Care Program is a 3-year public-private partnership because we wanted to see if we are able to at least impact part of the problem. And one company cannot manage the problem. And therefore, we need help from everyone, every party in order to address this. So, we are currently evaluating together with the Ministry of Health and the key hospitals on what is the evaluation and the impact this program has created, and what should we do in order to move forward, and what kind of programs and learnings that we have got from this program that we can implement going forward. And the Ministry of Health is also considering to take part of the responsibility and make it into a bigger program as part of their national diabetes prevention plan. And Novo Nordisk is committed for diabetes for the last 90 years, and we will continue to commit to improve diabetes care across the world, and Vietnam will not be an exception.
Do you have any recommendations for Vietnam in order to changing diabetes in the future?
In the diabetes management team, we have a concept called the rule of half, and I have something that I want to show to you, and this is called the rule of halves, where if you have 100% of the diabetes patients, only 50% of them are actually diagnosed, and of those 50%, only 50% receive some kind of medication, and of those 50%, only 50% of those people will get some kind of control, and in the end, only 7% of the 100% are able to manage diabetes, and that is a huge burden. And therefore, if we have to manage diabetes in Vietnam, we have to reduce the number of people who are diabetes. We have to increase the number of people who have to be diagnosed. We have to increase the number of people who receive the medication and proper care in the hospital, and we need to increase the number of people who are well controlled so they can prevent complications like eye disease, kidney disease, and loss of limbs and hands. And this is what will be the recommendation, that if all the parties, be it Ministry of Health, policy makers, hospitals, doctors, nurses, and the pharmaceutical companies work together towards reducing this at every level, then I think we have a solution for Vietnam, and I think it is achievable. While Vietnam is one of the fastest growing country in terms of economy and development, but it is also one of the fastest growing country when it comes to diabetes in Asia. However, I don't think the situation is as grim as other countries, because they are all in a similar situation. Whether you compare with Indonesia, which has close to 300 million population, or when you compare to Singapore, which has just 5 million population, they all have similar challenges. They all have a higher prevalence rate of 10 to 12% of the population getting affected with diabetes. So the situation is not any different. And I think the solution that I explained in terms of collaboration, public-private partnerships, and involving every party, whether it's the media, nurses, healthcare professionals, and policymakers, is the same approach that every country needs to take in order to address the burden of diabetes. What is good about Vietnam? Ministry of Health has already identified in 2011 that diabetes is one of the growing problems in healthcare system, and they have prioritized the National Diabetes Prevention Plan, and I think that is one of the very, very nice initiatives that the ministry has taken, where other countries are still thinking about it. So we are at least 2 years ahead of time in addressing the problem in Vietnam.
Once again, thank you so much for joining us, and we hope that when the program result between Vietnam and Novo Nordisk with this public and private partnership.
Thank you very much for your time.
That's all we have for today. Thank you so much for watching us. If you have any question or recommendation, please send us an email at sharingvietnam@vtc.com.